Hello, everyone. This is Steve Adams and Dr. Matthew McNamee from Tiger Medical Institute. And today we're going to talk about Dr. McNamee's approach to medicine. And I think it'll be insightful for you to understand this as you consume other content in our YouTube channel or on our website to understand at a very high level, how does Dr. McNamee approach your case compared to what maybe you experience at your current primary care physician. And the goal of today is to help educate you on that. We have no desire to say anything negative about your current doctor or a traditional medicine doctor. They do great work. It's simply what we're trying to highlight is differences in approach so that you can make an educated decision. Dr. Matt, how are you doing today?
Doing well. Thanks, Steve. How about you?
Good. Well, can you share how your approach compares to a traditional allopathic model to medicine?
Sure. I if I could think of some key maybe distinctions.
Sure.
The first visit that I spend with the individuals is set for 90 minutes. Sometimes it's longer if I see them in person for that visit. Mm-hmm. So I spend a lot of time digging into their, medical history and whatever concerns they have. Majority of other, primary care visits and that are typically much more limited than that.
Right.
I'm also, I also have the ability, based on our model to test basically at my own discretion. I have in a sense, kind of unlimited, basically, I don't have any really boundaries on what I can provide for testing.
Nope.
I'm always thinking about what sort of, techniques and diagnostics that I'd like to use to really figure out what would be the cause or causes of their unique presentation, whatever they're coming in to see me for.
Yeah, I've heard you talk about you're looking for the underlying mechanisms that are driving their symptoms and how they feel. And that's quite a bit different than the model that traditional classically trained physicians are taught in, correct?
Sure. Yeah. Normally you may look at, certain signs or symptoms an individual has, and then that can, basically provide you with the information on what sort of, typically like a, medication, possibly, surgical intervention that they may decide to proceed.
Kind of algorithmic in a sense?
In a sense, yeah. So, and then what I'm looking at a little bit more is, if you were to think of, just basically looking at a tree and all the symptoms were the leaves, and you go to the branches on down to the actual, basically stem of it or the root, is to see, what is the underlying physiological processes that are driving those symptoms, signs, et cetera. And a lot of times it's complex. There's a lot of things going on with individuals. We are in a time frame where there's a lot of, chronic diseases, mm-hmm. where they're driven by, they're multifactorial. Multiple things are contributing to them, and it's teasing out all of those aspects, which make them unique in each case. Right. And basically targeting those. And if we target those, right, those components and optimize that physiology, ideally, right, when you go up the tree again, those symptoms resolve, right? So I was talking to my one of my colleagues yesterday, and I was just stating that, a lot of more of the traditional model in a sense, we'll look at, a disease pathology, and however they test, they find you're in a diseased state, right? Whether it's laboratory work or imaging, et cetera, right? And that I was using kind of like a stoplight analogy. That would be the red light, right? And that's where we look at, and then we can treat that, right? On the other end of it, when you have really healthy, optimal cells, tissues, et cetera, right, and all the organs are working optimally, you've got the green light. right? So my goal, our goal is to find, the yellow lights in there before it gets to a full-on disease process, right? And find the dysfunction in the physiology, right? So that's the goal every time. And the goal is to take it from a yellow light, if we can, back to a green light, right? Back to optimal tissue function and health, right? So
and that's a big distinction, because in the other model, when you're, surgical is surgical, but when you're using pharmacological solutions, that's not really curing or treating anything. I'm not saying that's the wrong word. It's not curing things. It's not getting to the root cause. It's treating the symptoms, right? So you're kind of masking the symptoms in a sense, instead of actually getting down to what's causing the symptoms and resolving it.
Right. Yeah. In many cases. Yeah, that's correct.
Right. It's not always true. Right. Second question I have is, how is your testing different? I go to my primary care doctor still. We have a lifelong relationship. He does testing, but how is it different? I know it's more limited, because his testing is limited to what insurance companies and government pay programs will reimburse for. How is yours different?
Right. Well, just using that, I guess, as a foundation to speak about, like, when typically you go to your primary care practitioner, you'll get basic thyroid labs, you'll get blood work to look at your red blood cells, white blood cells, chemistry panels, you look at your lipid panels, your cholesterol markers, and all that stuff. May add a couple more things in there, maybe some inflammatory markers, and maybe a few more things. I do all of that, and then I'm able to provide a much more comprehensive dive sometimes into, like, the cholesterol markers, the inflammatory markers, the stuff that has to do with metabolic health and your propensity for things like insulin resistance, diabetes, etc. And then look at hormones in typically a little bit more in depth fashion, including thyroid, and commonly sex hormones and cortisol and DHEA, etc. So that's basically one of the initial ways that I start. But then I look at a lot of other things. I look at gastrointestinal health. So I look at not only the health of how well your organs essentially are functioning. Are you absorbing nutrients properly? How well are you producing enzymes, et cetera, to help break that food down? I also look at just the dynamics and the health of your the microbiome, all the collective microbes in your gastrointestinal tract, and just see if they look healthy. Are they unhealthy? They're not really unhealthy, but are they tipped in a balance where we have the ones that are beneficial versus the ones that can be potentially harmful, right? And so look at that balance, and then looking at the byproducts that they produce, as well. So that's gut. Then we look at sometimes we do imaging of the brain. Sometimes we do imaging other places as well, and another component that really I think makes what I offer these days really personalized is the level of genetic testing that we do. So that really can help, especially with the overlap when I was talking about inflammation or hormones or cholesterol or any of these things. We can really look at what drives your process. Some people are just have more of a genetic tendency to, create more inflammation, like myself. Others have, other tendencies that can contribute to this overall, potentially dysfunctional picture that we're trying to assess with different components of physiology in the body. So, and then other tests, we look at, the individual's, sensitivity to certain foods, look at, other angles we look to see sometimes if individuals have, autoimmunity to different tissues, or if any of that's actually starting well in advance before there's any, signs or symptoms of that going on. which is nice to catch ahead of time, because you can, many times prevent that if there's not, enough, if it's not advanced enough, tissue damage and destruction and that. So,
yeah, and you also do a little bit of cognitive screening as well, don't you, from your training from Dr. Bredesen?
Mm-hmm. Yeah, so we have some cognitive tests that you do in person with one of the doctors. We also have some cognitive screens that we do online. Taking that information coupled with, looking at your laboratory tests through a different lens, because a lot of these things have been shown through the science to basically contribute to that overall process that down the road can basically translate or manifest into different dementia processes, right? So we look at, what the common causes are. We look at inflammatory markers, blood sugar markers, nutrient markers, hormone markers, and things like that. And there's several others as well, all to look at what the unique potential contributing factors that may essentially drive that process down the road.
Yeah, and the genetic markers as well.
Correct. Yep.
I remember you telling me recently, Dr. Matt, that the level of genetics partner that we have today.
Yeah, it far exceeds, it's far superior than what I've had, or I think most people have had access to in the past. They created this company, years ago, because there really wasn't much, anything that really wasn't any really availability on the market, to provide enough of deep of a dive to really look at the unique genetic contributing factors that would, differentiate one person with this type of general genetics and that person, and then looking at all the other contributing factors around those genetic markers. So it really has given me a lot of insight and ability to really personalize those, whatever sort of plans I have for those with any sort of potential for cognitive issues or that have cognitive issues.
And what I was trying to say before I choked up was whether it's cardiovascular disease or something to do with diabetes or some other problem, the level of partner you have now, you could have several different people with the same condition, and you have the ability now to treat each one of them uniquely, rather than in the past where maybe you had one set of protocols to address the diabetes or whatever. Now you have an ability to really finely tune and be very precise with how you treat someone. Did I hear you correctly on that?
Yeah, absolutely. I mean, the only thing I would say is, I wouldn't have a set protocol generally for anyone with, let's say diabetes or anything. There's still a unique, you still look at, if you've got a dozen people, you're still going to approach them a little bit differently.
Gotcha. Okay.
And it really comes into honing in on the nuances and subtleties between their genetics. Yep. That, I think, really is what will really greatly impact the results on a much quicker, on a quicker rate, essentially.
So how are the outcomes potentially different versus someone who, goes the traditional route and is diagnosed with something and has to be on a prescription the rest of their life for that, versus someone who gets proactive and does the root cause approach? How can their outcomes be different in a positive?
Well, I think one, in a sense, and this is not for everyone, but I think the majority of it is a little more passive, right? We wait for something to develop.
Yeah.
Once it's developed, you take something, and then when you take it, right, your cholesterol markers go down or your blood pressure goes down, right? And there's no really necessarily looking at what's driving that process. What if we were to, address those multiple things driving that process, right? Then we don't have the need for potentially the medication anyway. So, it's just
it's a sustainable
which end do you want to kind of start from? There's obviously a blend and overlap throughout that process, but but
potentially it can be an enduring, sustainable solution versus
100%.
Reliant upon how that chemical interaction continues to work or not work for you. So
yeah, and then there's also people with certain medications, you get side effects from too. So that's
right.
not always
Right. So you can eliminate them potentially. Right.
right.
Yeah. Well, thank you, Dr. McNamee. This was always educational. And for all of you watching and listening, I hope that this was helpful. And what I encourage you to do, if you want to learn more, obviously you can search around this YouTube channel, but we also at tigermi.com, have a learning center where you can go and read from our subject matter experts over 100 different articles with videos on subjects that would be important to you based on how you sort that learning center. So I encourage you to do that as well. And thank you. Hopefully this was helpful.